My name is Sam and today I'll be doing an abdominal assessment. Can I get your name and date of birth, please?
My name is Craig. I was born 8th April 1983 and I'm 23 years old.
Thank you. And with this abdominal assessment, I'll be having a look at your hands, your face, and your tummy. And after that, I'll be having a listen and press on your tummy. Would you be alright with that?
It's cool.
So before I start my abdominal assessment, I'll be doing a general inspection of Craig and his surroundings. I'm looking for any medications, any vomiters, fecal matter, stomach bags, or feeding tubes that can be a sign of issues with the abdomen. Next, I'll be taking note of the patient's body habitus, of whether he looks obese, has a low BMI, or looks cachectic. I'm also going to be taking note of his complexion. If jaundice is present, that can be a sign of hepatitis or liver cirrhosis. If he looks pallor, that can be a sign of anemia or it can be due to a gastrointestinal bleed. Now, can I get you to can I have a look at your hands, please? I'm looking to see whether leukonochias is present, which is the whitening of the nail beds that can indicate hypoalbuminemia, which can be a sign of liver failure. Now, can I get you to do this with your fingers, please? I'm checking to see whether clubbing of the nails is present. That can be a sign of inflammatory bowel disease, hepatitis, or liver cirrhosis. Now, can I have a look at your palms? I'm checking to see whether palmar urethria is present, which is the reddening of the palms. That can also be a sign of liver disease or if he was a female pregnancy. Now, can I get you to lift up, lower your eyelids for me? I'm checking to see whether conjunctival pallor or jaundice is present. And can I get you to open your mouth for me? I'm checking to see if any ulcers are present, as that can be a sign of celiac disease or Crohn's disease. Now, can I get you to expose your tummy for me, please? Lifting up your shirt, thank you. And I'm checking to see whether any stoma bags are present, as that can be a sign of a bowel obstruction, or it can be it can indicate a previous surgical intervention. I'm also checking to see if there are any scars around the abdomen. For example, a large abdominal scar can indicate a laparotomy, while scars around the umbilicus or in the lower right quadrant can indicate a pars appendectomy. I'm also looking for any masses that can be, or any distension, which can be a sign of bowel obstruction, an abdominal aortic aneurysm. It can also be a sign of enlargement of the organs, such as hepatomegaly or splenomegaly, or whether ascites is present. Next, I'm going to be looking whether there are any pulsations in the abdomen, which can also be a sign of an abdominal aortic aneurysm, an increased blood pressure, or it can also be a sign of intestinal obstruction. Next, I'll be looking for whether Cullen's sign is present, that is the discoloration around the umbilicus, which can be a sign of retroperitoneal bleeding or a ruptured ectopic pregnancy. Next, I'll be looking at Craig's flanks to see whether Gray-Turner's sign is present. This would be, which is a bluish discoloration around the flanks. This would also indicate retroperitoneal bleeding is present. Retroperitoneal bleeding can be caused either by AAA, or it can also be caused by pancreatitis. Now, I'll be looking back on the umbilicus, around the umbilicus region, to see whether caput medusae is present. This is defined as the standard engorged veins radiating from the umbilicus, and this would be a sign of portal hypertension, which could indicate liver failure. Now, I'll be having a listen to your tummy. Would you be alright with that? I am auscultating before palpation or percussion, as these actions can influence bowel sounds. So first, I'll be listening to bowel sounds. And if none are heard within 2 minutes, this could indicate twisting of the abdominal organs or a bowel obstruction. Next, I'll be listening for bruits, which is the swishing sound heard in the major arteries, which can indicate vascular diseases within the abdomen or a AAA. So first, I'll be listening to aortic bruits. I'll be placing my stethoscope superior to the umbilicus. And if bruits are heard within during systole and diastole, this can indicate partial artery occlusion or artery insufficiency. Next, I'll be listening for renal bruits, and I'll be placing my stethoscope 2 to 3 centimeters superior and lateral from the umbilicus. And if bruits are heard during systole or diastole, this can indicate renal artery stenosis. good. Now I'll be having a press on your tummy. Would you be alright with that? So first I'll be doing a light palpation of every region of Craig's abdomen, and I'll be looking at Craig's facial expression, as any change in it can be a sign of pain. Now I'll be doing a deep palpation, okay? And if I feel any masses, I'll be taking note of its size, its shape, its location, its mobility, and its pulsatility. Next, I'll be checking for rebound tenderness. If rebound tenderness is present, this can indicate peritoneal inflammation. While palpating, I'm also checking for whether guarding is present, which is the spasm of abdominal muscles to protect inflamed organs. This can be a sign of appendicitis or a perforated intestine. Also, tenderness felt during palpation of the abdomen could mean problems with the underlying organ and warrants further investigation. So now I'll be palpating for Craig's liver, and I'll be placing my hand on the lower right quadrant and palpating upwards while you breathe. And every time he breathes, I'll be repositioning my hand. And if pain is felt in the upper right quadrant, this can indicate hepatitis. Also, if the liver is felt more than 1 centimeter away from the costal margin, this can indicate hepatomegaly, and if pulsations are felt, this can be a sign of tricuspid regurgitation. Next, I'll be palpating for your gallbladder, and I'll be using a technique called Murphy's sign. So I'll be placing my left hand on the left lower rib, and I'll be extending my thumb inwards to the abdomen. And can I get you to take a deep breath for me, please? And if pain is felt during inspiration, that would be a positive Murphy sign and can be a sign of cholecystitis. Now I'll be palpating for the spleen, and I'll be starting in the right iliac fossa, working my way towards the left hypochondrium. And if the spleen is palpable, this would be a sign of splenomegaly. Splenomegaly can be a sign of infection or liver cirrhosis. Next, I'll be palpating for the aorta, and I'll be using fingers of both my hands, and I'll be pressing down just above the umbilicus. And any outward expansile movement I feel can be a sign of a AAA. A AAA in a pre-hospital setting is of very high acuity. This is because if it does rupture, rapid exsanguination occurs, and there's very little interventions that we can do in a pre-hospital setting. Now I'll be palpating for Craig's bladder, and I'll be doing light palpations starting from just below the umbilicus, working my way towards the pubic bone. And if the bladder is felt, this can be a sign of urinary retention. Now I'll be percussing, so I'll be tapping on your tummy to feel the various organ. So first I'll be tapping to feel for the liver, and I'll be starting in the right lower quadrant, working my way upwards on the mid-clavicular line. So when dullness is hurt, this indicates the lower border of liver dullness, and I'll be starting from the nipple line, and I'll be percussing downwards. When dullness is hurt, this indicates the upper border of liver dullness, and from this estimation of the liver size is given. If the dullness span increases, this is a sign of hepatomegaly. Now I'll be percussing for the spleen, and I'll be percussing starting from the right iliac fossa towards the left hypochondrium. Can I get you to take a deep breath for me? If this sound changes from a timpani sound to a dullness sound, this would indicate splenomegaly. Now I'll be percussing for the bladder, and when dullness is percussed, this indicates that the bladder is being percussed. However, if a timpani sound is percussed, that indicates that you've percussed the bowels. So after this inspection, you can put down your shirt now. Thank you. If pancreatitis, cholecystitis, appendicitis, liver cirrhosis, or hepatitis is found, and there were no other organ dysfunction and vital signs were normal, the patient would be a status 3. Would be given the firm recommendation of seeking medical treatment, as these conditions can lead to many complications that are a threat to life. However, if the patient had abnormal vital signs or was in a state of shock, he would be a status 2. And if he was still in shock despite pre-hospital interventions, he would be a status 1. Thank you.